say na kwabade aba Royal Television so and Royal TV ababa BPM e State House forecourt anymore ni nyina and say Ghana Ace Commission e twaniti awa say GAC wo mo de dwumadi esonkon wi akyesha so ni nyina ne 20th anniversary afia bia e December bosom ni da edikan wo de dwumadi e akyesha so e de kai empo wo mo manya HIV AIDS ya wie kode ewuo e so mo mu ni so mani da so nyina san wo mo wiase nyina aba e de kai wo mo na wo mo so a wo mo tiase na ebi ewo mhono so mo de etufo na mo de aprichi say e basa na ewiase ansan ma ni da so wo ho na obekoso abon ho ban ene ade ade sante no na United Nations na aman kabom ko no wo mo beka ho e de dwumadie sonko sei na mo de asi omo nan so na ya celebrate wo kwan sonko enso e kra 20th anniversary way e koso e wo ye State House forecourt hanum say na wo say yentimi embra na Ghana mampani ene amampani ho na mpanifo betimi aba dwumadi aba be embrace no na yetimi ne o macheche nkomo ne ahwese de dwumadi mbeko yenko na yenko hwese de dwumadi no ebeko afa nana yabiama ene meji
had come at a time when we faced limited fiscal space, low revenues, rising debt repayments, and crippling emergency expenditures on COVID response. However, I assured you that government had nonetheless accepted the challenge to increase domestic resources through the operationalization of the National HIV and AIDS Fund. I am not reneging on this commitment. I will provide the details of government commitment when I launch the National HIV and AIDS Fund in the next few days. Distinguished ladies and gentlemen, as you are aware, the Ghana AIDS Commission marks the 20th anniversary of its establishment, and I wish to congratulate the Commission on leading a resilient national multi-sector HIV response, which has yielded the results we celebrate today. The anniversary is being celebrated under the theme 20 years of multi-sectoral response to HIV and AIDS in Ghana, accelerating progress to end AIDS. Madam Chair, this theme underscores the centrality of the multi-sectoral approach in Ghana's response to HIV and AIDS. Indeed, before the establishment of the Commission, the HIV response in Ghana was handled as a medical issue. However, the government and parliament saw the need for a whole of society approach to the HIV response, acknowledging that HIV was a developmental issue. Through the multi-sectoral approach, the Commission mounted and sustained a society-wide campaign against HIV. Indeed, the lessons learned from the AIDS response and the systems established came in handy in our response to COVID-19. As the co-chair of the eminent group of SDG advocates, I am happy to note that this theme resonates with SDG 3 on health and SDG 17 on partnerships for sustainable development. I want to strongly affirm my government's commitment to achieving the SDGs. Distinguished ladies and gentlemen, on this occasion of the 20th anniversary of the Commission, I wish to recognize and commend all the individuals, communities, development partners, and civil society organizations who have made distinguished contributions to our national HIV response. We celebrate their patriotic effort, which has steered the national HIV response from the early days of hopeless experimentation to its current status of a formidable institution poised to defeat AIDS. As I bring my address to a close, I want to assure all persons living with HIV within our borders that despite the challenging economic climate, government will continue to prioritize uninterrupted supply of antiretroviral medicines to guarantee your continued stay in care. Already, we have worked to enhance access to treatment by establishing at least one treatment center at almost all districts across the country. We are living in the golden era of HIV treatment and hopefully enter into that of HIV cure. We are also rolling out pre- and post-exposure prophylaxis for selected populations. Therefore, every Ghanaian should be bold, get tested, know their HIV status. Whatever the outcome, there is effective package of services available to you. God bless our homeland Ghana and make our nation great and strong. I thank you.
As a country, this year's World AIDS Day celebration is special because the Ghana AIDS Commission is marking its 20th anniversary. 20 years ago, when the commission was established, the HIV situation was quite dire as HIV prevalence was approaching the threshold of exponential growth of the epidemic. HIV prevalence in female sex workers, for example, was more than 70% in Kumasi, Tema, and Accra. Bed occupancy in many health facilities was predominantly AIDS-related. There was no treatment and no hope for persons living with HIV. AIDS patients suffered untold, inhumane treatment from families and communities. The Commission responded to this situation by embarking on massive social mobilization to unite all sectors of society to fight the menace. The media, traditional authorities, religious leaders, and faith-based organizations, NGOs, professional bodies, the public and private sector, among others, actively got involved in the fight against HIV and AIDS. Prevention and anti-stigma campaigns were permanent features on the mass media landscape, and community-based awareness creation and prevention education were undertaken in every corner of this country. Mass training of teachers and school heads was done, and HIV education was integrated into the school curriculum. While pursuing these efforts, the Commission had to employ evidence-informed strategic planning and results-based management approach to achieve impact. During the 20-year period, the Commission has led the development and implementation of 5 medium-term national HIV and AIDS strategic plans. These strategic plans not only helped us to scale up proven strategies and interventions, but also accelerated delivery of high-impact and patient-centered prevention, treatment, and care services. The strategic plans spelled out division of labor among donor partners, government, implementing partners, and other stakeholders, thereby preventing duplication of efforts and ensuring efficiency of use of scarce resources. One major strength of the multi-sectoral national response, as guided by the national strategic plans, is the use of science, international protocols, and best practices. The national response has made significant progress over the last 20 years. Over the period, the estimated adult HIV prevalence reduced from 2.5% to 1.6%. New infections and AIDS-related deaths in the general population reduced by 41% and 59% respectively. These reductions occurred across all age groups and gender. New infections in adult age 15 years and older reduced by 32%. In children age 0 to 14 years, also reduced by 65%. And young people, 15 years to 24 years, we had a reduction of 35%. AIDS deaths also reduced in adults 15 years and older by 59%, in children by 56%, and in young people by 50%. These significant reductions are the results of widespread use of antiretroviral medicines and application of data and science in programming and policy formulation. Incidents per 1,000 uninfected population also reduced from 1.56 to 0.57. The Commission will not claim for itself the credit for the achievement of these positive results. Continuous investment by our cherished partners, together with diligent and dedicated services of implementing partners and stakeholders, brought about these great results. Organizations and individual Ghanaians and non-Ghanaians made significant contributions to these achievements. The government has therefore decided to recognize the contributions of these outstanding individuals and organizations at an awards night scheduled for 10th December 2022 at Fiesta Royal Hotel, Jowulu, Accra.
World AIDS Day is something that I am very honored to participate in. It's a chance for us to remember the millions of lives that we lost since the disease was first diagnosed more than 40 years ago. And also to remember that 40 years ago, and even more recently than that, people died in terrible conditions, without hope, without treatment, sometimes without painkillers, often cast out by their families. We really have come a long way so that now people can be tested and treated and protect the ones they love. And we're doing work to get us to the end of the pandemic once and for all. We've been working with Ghana and the Ghana AIDS Commission for 20 years, since the beginning. And we're going to talk a lot about numbers. There's been a lot of numbers talk today. I want to talk about one Ghanaian who was affected by PEPFAR and Ghana Health Services programs. Gifty is a 52-year-old woman who lives in a Hafo region, and she started getting sick and couldn't understand why. She was ostracized by her family and community and even called a witch because she had those symptoms. Her business suffered. Her brother tried to help her and he got medicine, but he did this without telling her what she had or what the medicine was. And she got even sicker and was going blind and was deathly ill finally. And then a PEPFAR-funded HIV case manager came to her house. And after counseling, Gifty was tested for HIV and immediately put on treatment. Today, her condition has turned around. She's able to resume her trading activities, selling at the local market, and she has regular customers that deal with her without attracting discrimination or stigma. Yeah, I want to celebrate Gifty. And the thousands of people in Ghana and millions of people across the world who are like Gifty, who now can have normal lives and protect the people that they love. So I also think that as we celebrate the work and progress against the HIV pandemic, we can also celebrate ways in which our collective work has strengthened Ghana's whole health system. So this is about HIV, but it's about the broader benefits to everybody in Ghana. In the last 3 years, the world and Ghana have been challenged with multiple disease outbreaks. As the COVID-19 pandemic was finally showing signs of slowing down, Ghana was hit with unprecedented Marburg and monkeypox outbreaks. But Ghana responded really admirably to those outbreaks. And that's a stark reminder of the need to strengthen public health surveillance and response systems. But I really do want to salute the Public Health Service and you, Minister. Thank you for that important work. I'm pleased to say that the United States has invested more than $100 billion in the global HIV response through PEPFAR and as the leading donor to the Global Fund. Through PEPFAR, the United States government has saved more than 21 million lives, prevented millions of HIV infections, and helped over a dozen countries control their HIV epidemic. In the past 14 years, we've invested over $140 million to help Ghanaians slow the spread of HIV while supporting people and families living with HIV with life-saving medications. Together, we can break the cycle of transmission. Preventing new HIV infections and supporting those with HIV is not just about medication, though, or state-of-the-art supply chains and laboratory and information systems. It's about education and reducing stigma and discrimination about the HIV epidemic. So, again, those messages that my friends are wearing are very important. We need to work together to ensure that HIV-related commodities are procured without interruption in treatment and that test kits are widely available. And that's even more important in these very tough times that Ghana is facing. We must also be vigilant about proposed policies that will negatively affect the HIV/AIDS fight. Across the world, draconian anti-LGBT legislation threatens public order and public health. Progress in the fight against HIV will be set back if policies drive people living with HIV to conceal their status or hide their sexual orientation and avoid testing and treatment. Such laws have deadly consequences for those communities, but also the broader population, and that's true in Ghana too. We can't achieve our goal to end HIV/AIDS as a global health threat if we deny people human rights or if we allow discrimination against people living with HIV and AIDS. The global theme for World AIDS Day this year is equalize. And this theme resonates here. We know that equitable access to health care is important in gaining control of the pandemic. Ghana has taken the bold step to define its universal health coverage vision for 2030. I'm quoting, "All people in Ghana have timely access to high-quality healthcare services, irrespective of their ability to pay at the point of use." I would also say irrespective of their HIV status or sexual orientation. Let's continue our work together to erase barriers to quality HIV service access, such as stigma and discrimination, gender-based violence, and discriminatory legislation that further marginalizes individuals, including the LGBT community, racial and ethnic minorities, and women and girls. If those living with HIV can access healthcare, testing, and life-saving treatment without discrimination, we will achieve our goals.
And a lot of young people are here. My only worry is that young people are not given the opportunity to talk.
Okay.
So
why?
I think it is where Ghana places young people in the country. You know, the voices are, and you know, the recent HIV prevalence showed that young people are getting infected. About the 76,000 plus that we have the new infection for 2020. Young people form the larger population. And so today should have been for young people. But unfortunately, they are not part of the thing, so we are just celebrating. What does HIV, World AIDS Day, what does it tell us? We are reminding the fallen heroes, the people who fought. And today, young people are very key in our HIV response. Women are very key because we still have children being infected with HIV. That means that if we allow children to continue getting infected with HIV, we can never do away with HIV in this country. And
What are the expectations?
well, personally, I work with Hope for Future Generations. Our expectation is that the government should put in more resources for HIV education and prevention, because now we don't see much on HIV prevention. And also, we have some commodity gaps for the treatment, ARV. So the government should start it. We know that the government is doing something, but we need to do more if we want to end AIDS by 2030. 2030 is just around the corner. Donors cannot do it for us.
Are you sure that by 2030 we can fight the deadly disease?
Yeah, I think that there should be stronger partnership with media, civil society, and the people themselves who are infected with the disease. There are so many young people with HIV. What are we doing?
Okay, I learned that we should not stigmatize people who have HIV. We should rather encourage them to live well. Like they should have they should be happy living. They shouldn't feel sad living. Yes. No. Yes, I'm sure. No, I'll use it to advise my friends who want to have sex. I'll give it to them to protect themselves because I saw it on the board that 1 round, 1 condom. So I'll just give it to them. Okay, I'll advise them not to have sex, but then if they want to, advise them to protect themselves, yes, before using it, yes.
Namina Dumo. Never pee. Ebi say, once I girls na yabano, yeah, raw. Any money that raw. Na yakoto.
Ebi mo ne me money that raw.
Oh yes, I am pa. Na yakoto some contraceptives be. But since yeah. Ba yenya ntie say yawe wo ho HIV nti anka ye be aha eno woni ne dawe ana so mpese wo benyima na wo ede na wanu na ma we ne pie ba sisi yawe aba na yesi yawe no e doso I increase nti no yen sheroba condom na mfesi anu kwan. Oh, of course, yes, me GBI. Oh, me need be momba. Anything can happen. Yeah.
Mega construction number say yeah, omo ye sanya mana omo hwamu. Omo na kwa omo hwamu hu ye. And I say afi omo ye 1 condom 1 round. Enti ya omo hwe bi na omo nkoye ne fala say and omo san ko share some more HIV no omo then omo nya treatment. Na enti me prevent spread no. Missing say in case me use condom for each round and I am be checking me who say menya sanya manivia 15 Bachelor that
we married 16. Oh yeah, only when oh that mini girl. I'm making. So yes, I say like only like only what down for now get baby no more be like you use something to protect like all the best like obeti use condom ne nuane asefo no ebi su ne most like me nuane mu nyina ofie online no and like me nko me ti me nko na me ko fa se me de Costco if say me nuane mu ofie me use what ase enti dey ya no omo ya de bi ameka chese protect yourself me I'm Swansea at the talk e be me we at the talk meka chese omo ya de a omo ye ni ye like omo use some part ni we ba omo ye sometimes me scatter at the month so omo ye omo so omo no na ye we nti I sort say ba na we ye film so be na
Jumadia yi atetrefo ene ntie kukuni edi omoni onyam wukotwe bi dia na tese omodoso ye pa nyina nsem omuka nyina ne sese de be beboa ne atu yare kode wu HIV AIDS no asesa wo hwemachi ha nipa abodom pemesukufo ne ade ene empo examination bi ekokoso na ebusua eno ne ade sonko o maye na ebo obi adwene nti ase so sample wo BP sabi wo yare boni HIV AIDS estro san say ye free wo kombetimi a check amawa woni onyamfo kwakwa jama manu mu nyina no etimi bowura ho ekohwe sania wo matimi ahye nia mama na ye krabehwe de abusua na chese enne no dwumadi no matom bo ase aye 20th anniversary no wo mo de asi omonan so aye amani onyam hye abemu abusua na ya bia man ni medi na dwumadi ye bepie mu wo State House for Court Royal Television so ene makam